But I was going to do a short, the logistics, and then let you do.
Okay, that's good.
So this is, well, I just wanted to, yeah, I'm going to go up there. Okay. All right. No, I didn't.
And these are, I mean, two different models.
Okay. No, you need it.
Okay.
On your tie.
Okay, you got it.
Yeah, I have one. Okay, so we're going to go ahead and get started. I'm going to do some logistics because we have a combined seminar this week. And so we have some overflow. If you came in late, we have an overflow room, room 304, that you can watch remotely upstairs. I didn't realize that there were so many public health students in the public health portion of the seminar for the room. So anyway, my name is Jennifer Day. I'm a faculty member in Urban Studies and Planning and director of the Center for Transportation Studies. And this is our room for our regular weekly transportation seminar. And there is an overflow room, room 304, if you'd like to, if you don't want to stand, because that's my seat. Yeah, sorry. So anyway, for those of you in the back, if you're just coming in, you can go to room 304 if you want. I'm going to repeat that too many times. So this is a joint seminar this week between public health and transportation. So welcome all of you from public health who haven't come here before on our Friday noon seminar. We do webcast the seminars, which is why I'm holding this microphone. It's so that people watching on the web can hear me and you and our speaker. And so when we get to the question and answer period at the end of the talk, we ask that you use the microphones on most of the desks, and you hold the touch key with the red light lit while you're asking the question so that the people on the web can hear you. If for some reason there isn't a microphone nearby or if it's not working, I'll try to come by with this portable one so that you can be recorded. And yes?
People in this other room ask questions?
If the people, that's a good question. You can, anyone watching on the web can send an email to psuseminar@yahoo.com, and I'll be checking email for those questions, and if, depending on time, we can ask those. If they're in the other room, maybe I suggest that they come down and stand in the back to ask their question, because I don't think we have a mechanism to communicate from there. This is, normally we don't have this many people. This is sort of new for us. Those of you who are enrolled in this for a class, the transportation seminar, I'm going to remind you that your written assignments are due Tuesday by 5 p.m. If you have a question about that, stop by and talk to me afterwards. And we're trying to wrap up today's seminar right around 1, so I want to have Carlos and Jim come up here. And Carlos Crespo is the director of our School of Community Health. And this is an example. We're trying to create more partnerships within our college, and I think this is a great example of the co-sponsoring. So I'm going to hand it over to him.
All right. Thank you. Thank you, everybody. It's on the web. I'm going to introduce Dr. James Sallis. He's at San Diego State University, but he's also director of the Active Living Research Program from Robert Wood Johnson Foundation. It's a small foundation in the East Coast. You probably heard about it. But they have committed a substantial amount of dollars to stop the growth of childhood obesity. And from that $500 million, there is a significant amount of dollars that are going for active living research. Dr. James Sallis has been working for many years in the field of physical activity and public health. And as you know, public health is interdisciplinary, and a lot of the stuff that we get it done when we work with people from other disciplines. And this is one of the examples of how we want to increase physical activity by involving people from different disciplines. And I don't want to say too much because I know he's going to have an exciting presentation today. I have the opportunity to work with him in the Active Living Research National Advisory Council, and there is a great commitment to make sure that we bring people from our disciplines into the field of active living research, and I look forward to his presentation because I think it's going to be exciting to hear what we're thinking about when we work with others. Thank you. Oh. Okay, yeah.
Hi, thank you very much. And just so you know about a little bit of the interdisciplinary work, I do work in public health, but I'm a psychologist by training. I have no public health degrees, so I don't make any claims on that. Let's see, okay. All right, so, Okay, so I'm going to talk about mainly built environments today and how they relate to physical activity, and integrate a little bit about obesity as we go along as well. And toward the end, my goal is to give you a little bit of this, the background of why we're interested in built environments and physical activity, an overview of some of the research, and at the end I'll give you just a little bit of introduction to active living research in case you're interested in that. Okay, to put things in perspective, because not everybody here is a public health person, I really like this concept of 3-4-50. Which comes from the Oxford Health Alliance. And so you can read more about it at 3450.com. And basically, the idea is 3 behaviors of tobacco, physical inactivity, and poor diet. 3 behaviors contribute to 4 chronic diseases that we all know that explain more than 50% of deaths in the world. And this is all over the world. So you see physical activity is one of those, and you see the diseases, and most work is focused on the diseases and not the underlying causes. So we're actually interested in the underlying causes. And so physical inactivity then, because of that, is one of the central health concerns of our century. It's not being treated like that, but in fact the data say that it is a central problem. And so worldwide, 2 million deaths a year are attributed to physical inactivity. In the United States, approximately 200,000 deaths per year. That's a very old estimate. That the CDC is, Centers for Disease Control is updating that estimate now, so we'll see what that comes out to be. Just to put it in perspective, smoking causes about 400,000 deaths a year, about twice as many. Alcohol causes about 100,000 deaths per year. And just to point out one thing that I find a little hard to explain is that you might know that there's a National Institute of Alcohol Abuse and Alcoholism at NIH, right? There is no Institute of Physical Activity. There is no Office of Physical Activity. There is no single person at NIH with responsibility for physical activity. I find that a little disturbing myself. What else do we have? 6% of medical cost due to physical inactivity in the countries where it's been assessed, and comparable to tobacco. And obviously, physical inactivity plays a role in the obesity epidemic. And we're going to have to change physical activity to get to a solution, certainly a long-term solution in obesity. So how are we doing in promoting physical activity? Well, the kind way to put it is we could do better, right? Now, this is leisure time physical activity. And, this stops about 2000, but there's been very little change since then. Look what percent of people report meeting guidelines for physical activity. Less than 25% of the population, right? Not very many. And there's new data where we have nationwide results from accelerometers, objectively measured activity on a sample of the population. And instead of 25% meeting guidelines, the estimates for adults are now closer to 5% when we look at how much movement people are really doing. So here is one of the a behavior that's related to the leading diseases. There's not much attention being put to it, and very few people are meeting the guidelines of doing basically 30 minutes of physical activity a day. And so you'd think, oh, it can't get much worse than this, but actually it does, because of the work of the transportation profession in large part, not in Portland, but in the rest of the country, working really hard to make it possible and convenient and desirable to go everywhere by car. We've succeeded. That intervention has succeeded in cutting the percent of walking trips in half. Right? So we're down to started at a very low level in the 70s and went down by half. Right? So in fact, transportation-related activity in the country in general is going in the wrong direction. So people are actually getting less active. And why is that? Why does activity seem to be going down? Why aren't people more active? And if we agree that probably people are less active now than they were 70 or 100 years ago, is it because people have changed? Is it because our biology has changed? We enjoy activity less than we used to. We're getting less social support for physical activity. How many of you believe that we're less active now than 100 years ago because people have changed? Aha, I think we have a lot of planners in this audience. Okay, certainly not a lot of psychologists. How many of you think it's because we rely more on cars to go everywhere, computers at work have taken physical activity out of work, and we entertain ourselves with a never-ending supply of engaging electronic entertainment? Of course. Okay, right. What are we doing to promote physical activity? Besides almost nothing, you know, most of the research has been on educating individuals, motivating individuals, you know, putting a few ads on TV, and I mean very few, you know, putting out brochures about the benefits of physical activity. All of it focused on people, although most of us agree it's not the people, it's the environment that's the underlying cause. So we're trying to bring the focus back on the environment, right? So that's a lot of what I'm going to talk about. And so, you know, in public health and certainly in psychology, this is not the way that we've been trained in thinking about health problems. Most of us are, certainly from a health promotion point of view, are mainly focused on individuals, but we're trying to change that a bit. So we think we've created a world that makes it difficult, impossible, or unsafe to be physically active, and harder to eat well also. So, but I'm not going to really get into that very much. But if you don't have healthy food in your neighborhood, and you don't have a car to go out of your neighborhood, how are you supposed to eat well? Well, it's not going to happen. You know, you can't. So it doesn't matter. And this is how I got into this in the first place. We had a program where we were working with families in lower income areas of San Diego. And we wanted to teach these families how to eat better and how to be active. And we decided, well, let's look around at their neighborhoods and see what's there. So we did an inventory of the food sources, the grocery stores, and found that there weren't supermarkets. There were all these small stores, and we looked for all the healthy foods that we were recommending, and they had almost none of them. And if they had, you know, fresh produce, it was brown wilted lettuce and really wrinkled up apples and oranges and nothing else. And the low-fat meats, the low-salt vegetables that we were recommending simply didn't exist. So the people were unable to follow through on the motivations that we were helping to build in them. And like with physical activity, they might have had a park nearby, but if they did, it was run down, there wasn't good play equipment. Most of the streets didn't have sidewalks. It was a lot of traffic. It was not pleasant or convenient to be active. So I said, well, it's very little chance that our educational program is going to work. And in fact, it did not. So I said, all right, we've got to focus on the environment here, so that's what I've been trying to do ever since. So for long-term solutions, built environment changes are probably going to be essential. Built environment changes are permanent. Our behavior change efforts are notoriously impermanent. You motivate somebody to exercise, they'll go out and do it. When the classes are over, the environment pushes them to go back to where they started. And if we believe if we have favorable environments, that should improve the effects of individual interventions. So that's something I want to focus on for just a minute. So I really think of Portland as one of the main leaders in trying to create pedestrian and bicycle congestion, right? And trying to reduce car congestion. But the idea here is you can get different kinds of congestion depending on how you build things. And so it is possible. A lot of people in the U.S. have never seen a congested pedestrian environment or a congested bicycle area. And I just have to think that has to be San Francisco. I don't know where else you could see that. So we talk about activity-friendly environments, places that make it easy, convenient, safe, to be physically active, either for transportation or for recreation or other purposes. And we use an ecological model. How many of you are familiar with kind of the simple ecological models like this? Okay, well, not everybody, but some of you have been kind of trained in this. So, as a psychologist, we're trained to think about psychological factors, emotional factors, behavioral skills, and the interpersonal environment, your relationships with family and coworkers and peers and folks like that. And so our models tell us that's all that matters. Those are the only things that affect environment. Whereas if you're from the planning world, you're really always talking about the physical environment in the policy context, right? And you don't really learn too much about get in too much detail about psychological factors. But in fact, the ecological model, the main idea is that all of these factors are important. And behavior is a very complicated process, and you need the support of factors at all of these levels in order to be successful. And so we'll as we go through the talk, we'll see some examples of that. But the idea is not that we just need to create a good built environment and then people will come and use it, because that doesn't necessarily happen. In fact, we've seen quite a few examples of evaluations of taking rundown parks and renovating them and then looking to see what the impact of that is in bringing people there for physical activity. And sometimes it's effective and sometimes it isn't. And so we believe that just having the right built environment is necessary, but it's not going to be sufficient. And so let's see, do I have this? No. So what we believe we need to do is create a favorable built environment, have policies that encourage people or give them incentives to be active, but then change people's beliefs and attitudes and motivation to take advantage of those opportunities and create a supportive social environment, either through working with institutions like work sites and schools and churches, or through mass media to show it's normative and normal to be physically active and to walk places. So the idea is you can't just focus on any one of these. You really, if we want to be successful, we have to do all of the above. And I think the best evidence that this multi-level approach can be successful in the health area is tobacco control. Because in tobacco control, all of these things were done. policies were changed, taxes were put into place, access to cigarettes and places to smoke was restricted. There's been a lot of counter-advertising, the Truth Campaign, a lot of social norm change, and people who wanted to quit were assisted in learning how and developing the skills to quit. So tobacco control is a wonderful example of using a multi-level ecological model. Okay, now I want to get into a little bit of the research, and most of the research I'm going to describe to you is cross-sectional because our human subjects committees do not allow us to randomize people to the neighborhoods where they're going to live. And they don't allow us to randomize which neighborhoods get parks or bike lanes or anything like that. So we have to just study what's in front of us. But in some small cases, people have done kind of pre-post or sometimes randomized trials to see what is the impact. If you change the environment, what is the effect on interventions? And so here's some examples of areas where we have actual pre-post or maybe controlled trials looking at changes. Building trails. There's been a lot more of this in England and Europe than in the U.S., but there's now a pretty good body of evidence showing if you build trails, especially near around population centers, you get a lot more people walking. Traffic calming makes people feel more comfortable and safer, and so that tends to be effective in getting more people walking and probably biking. There's a whole literature on stair promotion, and two sets of studies. One, just putting up a sign, often at where you have a chance to take either stairs or elevator or escalator, and signs. Take the stairs, it's healthy, that sort of thing. And it tends to work. Not everybody takes the stairs, but an intervention that costs virtually nothing will have an effect on behavior as long as it's up. So this is one of the most cost-effective interventions that we could possibly have, yet the dissemination and use of this across the country is minimal, negligible. So we have some interventions that work that just need to be used. Oh, the other thing is making stairs nice, right? A lot of stairwells, they store the cleaning supplies there. They expect nobody to take them, so they don't clean them up. They smell bad, etc. So if you put art and music and open them up and lights, people take them more. And then we have a couple of studies, one published quite recently, that people who move to activity-friendly neighborhoods seem to increase their physical activity compared to what it was before, which answers, I think, one of the common criticisms of the studies that I'll present next, that we find that people who live in walkable neighborhoods walk more, and the criticism is, well, yeah, the people that want to walk move to places where they can walk. Well, this kind of study helps show that it's not just the person, it's the environment as well. And remember, the model is that it's not all about the environment, it's not all about the person, there's multiple causes of behavior. Okay, so the planners will find this very boring. Oh, what does walkability mean? It means that you can walk to places where you want to go. And so classic, okay, New York City, the most walkable city in this country. Mixed use means people live where they want to walk, where they want to go. There's density so that the distances are not far, and the streets are connected so that you don't have to walk around the world to go 100 yards. And so here's a classic low walkable, single use, so there's no place to walk to from the suburbs. And even if you did, the streets are not connected, so to go a little distance, you often have to go really a long way away. Now, so that looks like classic American suburb, doesn't it? But it's not. This is in the middle of Europe. Okay, so they are taking our lessons that they probably should not be learning. The only distinction, I think, between this and most of our suburbs is about here, where I'm standing, is a tram stop, okay, which you don't see in our suburbs. Okay, so what do the studies show? There's 11 studies now showing that adults who live in either walkable neighborhoods or places with lots of recreation facilities are less likely to be overweight than people living in less walkable neighborhoods. So there's a review of this. There's a few studies looking at this sort of thing in young people, and they do not see the connection with obesity. Now, here's a very simple summary of the literature that we put together that you can get off the website of the President's Council for Physical Fitness and Sports, where we just tried to summarize the basic findings. Now, these are for adults, and what the main lesson here is that different kinds of built environment attributes are related to different types of physical activity. So we look at active transportation, and then we look at active recreation. And so we find that walkability is very consistently associated with more active transportation, but has no relationship to recreational walking, usually, or biking. So it's just not connected there. Sidewalks, not really clear about the relation to active transportation, but there's several studies showing that if there's sidewalks, people are more likely to do recreation walking. Proximity of recreation facilities, very consistently related to recreational physical activity, but not for active transport. And then the aesthetics of the recreation facilities are surprisingly strongly related to recreational physical activity. So again, it's not just having a park or a trail nearby, but if that park or trail is run down, there's no equipment for for activity, or it's a lot of graffiti or just poorly maintained, people won't use it. And all right, so here's just a few examples, and this was done from participants in a clinic, and they found that people were twice as likely to meet physical activity guidelines, 30 minutes a day, 5 times a week, if they lived near 3 or more destinations in walking distance. And so a difference between 15 and 26%, just an example there. All the planners know that people that live in walkable communities drive less. And this is at least the second study, maybe there's more, showing that driving is a risk factor for obesity. So there's other studies that show this. But look, the people who drove the least in the lower 25 percentile, only 9% of them were obese. The people that drove the most, almost 30% were obese. That's a big difference. And so interesting, driving itself seems to be a risk factor for obesity. Okay, and I just want to give you a little preview of a study that we've been conducting with my colleagues Brian Salins, who's a health psychologist, and Larry Frank, who is a planner. And we've been studying 2 parts of the U.S., the Seattle-King County region and the several parts of Maryland between Baltimore and Washington, D.C. And what we did is we selected neighborhoods, or basically clusters of census block groups, that we determined were low and high in walkability. Because if you randomly select neighborhoods in most of the U.S., you get mostly low walkable. So we wanted to make sure we had a lot of high walkable and low walkable. Low walkable, easy to find. And at the same time, we stratified them by socioeconomic status, which we did by census-based income, and we got low income and high income, because we wanted to see if the associations between walkability and physical activity were similar for low income and high income people. And so we did this study with adults, and we recruited about 2,200 of them. And here's our physical activity data that was based on up to 2 weeks of monitoring with accelerometers. So it's objectively based physical activity, so we could see the actual impact of walkability on overall activity. And we basically saw the same pattern in low income and high income, and just a little bit different numbers. But if you look at the high income, there's about a let's say a 6 or 7 minute walkability effect between the purple and the green, and so if that's per day, so if you multiply that out, it's more than 40 minutes. And so that's so the people that lived in the high walkable neighborhoods were meeting the physical activity guidelines about 1 day per week, more than if they were living in low walkability. And that's in a educational program, we would think that would be an excellent outcome. But the difference here is that this should go on forever, as long as the people are living in those neighborhoods, which is a very different kind of outcome than if you're intervening on individuals. And so not quite, just couple of minutes difference with the low income, but the same pattern and similar benefits. So we looked at also the percent of people who were overweight or obese, and we found a significant walkability effect here, and the effect was similar for the low income and high income. So again, if you just look at the high income, you look at the high income, it's about 60% that based on their reported height and weight are overweight or obese, and that's exactly the national average from CDC data. But if that's in the low walkable, the high walkable, a 12 percentage point difference. So that's a really big effect. Not as big effect with the low income, but still a substantial difference, quite substantial difference. So that gives you a sense of the potential impact of the built environment on these two important outcomes. But you know, the level of walkability in the U.S. Is very poor compared to other places in the world, like particularly in Europe and Asia. So here's a walkable street in Belgium. Okay, and you'd be hard pressed to find a place like that in the U.S. I think. So we decided that we would look at some of these things internationally. So we surveyed, I don't know, about 11,000 people in 11 countries on four continents, high-income and low-income countries, and asked just a small number of questions about their built environment. And you can see how they relate to meeting physical activity guidelines. And so single-family houses is a question really about density, and that was barely non-significant. But if you have shops near your home, you're more likely to be active. If you have a transit stop near your home, if you have sidewalks, if you have facilities to bicycle, if you have low-cost recreational facilities, all those were significantly related to physical activity. Perception of safety of crime, not related. So this is the crime issue is clearly very important, but very difficult to study, and there's inconsistent findings there. But here's the thing I thought was most important, and I think this is an older slide. but the basic thing is the same, is that this is an index, the number of activity-friendly characteristics that we studied from those other items. And you see there's a dose-response relationship there. The more activity-friendly attributes in your neighborhood, the more likely you are to be physically active. But it didn't become significant until there were 4 attributes out of the 6. So that kind of is a signal to me is you really need a package. You know, there's not just one thing that you need, not just mixed use or not just a park, but it really seems to take all of these things. And in our final analyses, when the people had all 6 of these attributes, they were twice as likely to meet physical activity guidelines as if they had 0. All right. So I think that's an important one. And this is one that may be interesting to you. In Portland, this is this fellow Jens Troelsen was just visiting with us in San Diego, and he had done a study to evaluate making his city in Denmark even more bikeable than it was at the beginning. So let me just show you some of the things that they were doing, and you'll have a sense of whether how much you're doing those things here. So you know, Denmark is famous for having kind of protected bike lanes, and actually this one isn't protected. It's really just a line on the street. But you see here they have special right turn lanes for cyclists, so they don't have to slow down. So the idea is they had this campaign from 1999 to 2003 to do everything they could in this one city to basically seduce people to come out and ride bikes, to make it better and better and better in every way that they could think of. So this is one of them. This is called the green wave, where it gives them a signal and they know whether they're likely whether they're going to hit a green light if they stay at this speed. So it's not for cyclists, it's not for cars, it's for cyclists. And here's a more protected bike lane because it has the curve, and most of them have that kind of protection. This is one I really like. It's cycling counters. So every day it tells you how many cyclists have gone by the trail at this point, right? So it makes cycling very visible, and I thought that was really a fun thing to do. And you can set goals for these kind of things, and you could have competitions from city to city if you wanted to do that. Very nice measurement strategy. And during this time, 1999 to 2003, they did 50 projects, and here's their results. Cycling increased 20% over this 4 years from a very high level to begin with in Denmark. And at the same time, accidents, crashes with cyclists decreased 20%. So I think this is reason for a lot of optimism, that if you really make these changes, you can improve even on a good situation. So that will maybe spur you to even more innovation here in Portland. So let's talk about kids. So all this has been about adults. Let's talk about kids, a little focus on kids. And I just want to give you a few examples here. But basically, we find the same thing in kids. Kids that live in walkable neighborhoods are more physically active. Kids that live near recreational facilities are more physically active. So this is not having mixed land use. This is having mixed land use. And so in basically the suburbs, 9% of children had a walking trip over 2 days. In more walkable neighborhoods, twice as many kids had a walking trip. Now this is in Atlanta, so the numbers are really low. So only 18% walked anywhere, even in the best case in Atlanta, right? Yes, question?
Yeah. But you said that for youth, there's no relationship between obesity and walkability?
Correct. Yeah, built environment and obesity, people have not seen that, right? So, but you think about it. Obesity is not something that happens overnight, right? So people, most adults, gain a pound or two a year. So obesity is something that used to occur over decades. Now, a lot of kids are obese, but it still is something that grows, over many years. So the level of exposure to, let's say, activity-unfriendly environments is much less in kids. But if they're less active, that's a risk factor for obesity over time. Here's a very small study that we did in San Diego on some existing data. 98 adolescents, but we had objectively measured walkability and physical activity assessed by accelerometers. And so we explained walkability was a significant contributor to overall physical activity, explained about 5% of the variance. And you say, well, that's not very much. Well, but it was the same amount of variance explained by ethnicity and gender, right, which are pretty important factors in relating to activity. Now, in this one, access to recreation facilities was not related to activity, but in most studies it is. And we did another study in San Diego where access to rec facilities was related. Walking to school. This is an interesting one. This is based on our Seattle and Baltimore study. Of our participants, 200 parents reported on kids active commuting to school. And as you see here, the kids in walkable neighborhoods were over twice as likely to walk to school as the kids in less walkable neighborhoods. And that's probably due a lot to proximity because the schools would be closer and not have to be in driving distance. But the very interesting thing to me was that parent concerns about safety were the strongest contributors to walking to school. But the concerns were mostly about traffic, and the concerns were higher in the suburbs. And you hear that a lot of families move to the suburbs because, oh, this is going to be great for my kids. But then they get there, and they're really worried about the traffic, so much so that they don't let the kids walk to school. So I think there's some opportunities for education here. Okay, I want to talk a little bit about parks. This is one of our active living research grantees, Myron Floyd, and he's studying where do people do physical activity in parks to try to give us information. How can we design parks that are going to lead to the most physical activity? And so basically he found all the places in the park where you could do physical activity, and they mapped those out and labeled them, and then they observed each of these areas to see how many people were doing physical activity and how active were they in these areas. Okay. And so he studied 2 cities. I'll just show you one. And these are the different activity zones, as they call them. And this was the average activity level of the people in those zones. Now, EE is energy expenditure, so it's kind of an intensity measure. The more, if you were running, you would get a high score. If you were walking, you'd get a medium score. If you're sitting, you get a low score. And so you see the 2 least active places were a shelter for sitting, and then fishing, which is not known for being a very aerobic sport, usually. Even fly fishing, I think, is not quite aerobic, right? And the most active were basketball and tennis, all right? So if you wanted to have parks that really stimulated a lot of activity, you want to make sure to have basketball and tennis. But also playground, open fields were pretty high. But of what you would think of as the real activity zones, what was the least active? Softball and baseball. Well, that makes sense because those are not really very active sports. But this brings up kind of a policy question. If one of our goals is to get people active, how much of our parkland should be devoted to baseball and softball that really don't generate much activity? But so I think we're learning things here that will communicate to park designers. Here's a study from Australia. I think we can always learn from people in other countries. And in their study, pardon me, about 30% of people used parks for physical activity, and they were most likely to be used by walkers if they were nearby, large, and attractive. All of those three features. Because you don't want to walk around a small, tiny park, because that's just boring, going around in a circle. And what made it attractive to people were trees, water features, birds, and a variety of landscaping. We had a question here?
Yeah.
Push your button.
Okay, so I was just wondering on that last slide, it's just for that activity, it doesn't take into account how much the activity was done? Like, if the basketball
The
court
length
was
of
never
time,
used,
no, it doesn't. Doesn't take that into consideration. They have additional data that they can look at, and what I'm hoping that they'll do is over the course of a typical day, how many total calories, let's say, were generated, where you look at the number of people, how active they were, and the amount of time. So he'll do that later. Yeah, push your button.
I noticed trails aren't on the list of things they looked at.
Yeah. I don't know why trails are not there. We have other studies on trails. So we have a lot of, there's a lot of data coming about trails. Yeah, one more?
Yeah, and so this is not zero-based, right? So this is all way better than watching TV?
Well, this is probably not that much better than watching TV because no, it's not zero because it kind of estimates, factors in, kind of your basal metabolic and that sort of thing. That's why we're not at zero. Yeah. Yeah. Okay, so here is one study where access to parks was related to obesity. Now, this is number of recreation facilities, and that's private and public. And the pink is physical activity. So the more facilities that you had in your neighborhood, the more active you were. But the blue is overweight and obesity. So wait a minute. No. Yeah. Let's see. Odds of overweight. Yeah. Yeah, that's right. So the odds of overweight go down with the more recreation facilities. So, and this is a national study. So I think that's very encouraging, very large study. Now the bad news from this study is, without going too much into this is the relation between access to recreation facilities and income in the neighborhood. And so basically, all facilities, you're twice as likely to have any facility in your neighborhood if you live in a higher income neighborhood. And you see, it doesn't matter what the facility is. You're more likely to have access to it if you live in a higher income neighborhood. And so there's several studies showing this inequality in access to recreation facilities. So this is definitely a problem, and it's a problem that can be dealt with through policy at some level, but I'm not sure what we do to retrofit. It's not like you can create new land in low-income neighborhoods to help with this, but it's something that I think as a society we're going to have to deal with, because of course the people in being in a low-income household is a risk factor for obesity and might be for physical activity. Yes?
But isn't that kind of switching the cause and effect? So if you had recreational access in your neighborhood, wouldn't your real estate property go up? therefore you become a higher income neighborhood the more facilities you had?
Probably, but I don't think we have particularly good evidence on that. But it does, that you're starting to get at the kind of issue of gentrification. If you take low-income neighborhoods and make them nicer all around, kind of what happens then. And I think it's a big question, and I don't think we've seen good answers to that. So that's something we have to confront more, both on the overall land use and for recreation facilities in particular. Now, some good, I think some good news is that it looks like for some minority populations, this is some evidence that having access to recreation facilities can be a really effective thing. So if you look at the non-Hispanic whites, it didn't make much difference whether they had a lot of recreation facilities nearby or not for their physical activity, because as we know, race and ethnicity is related to socioeconomic status. So they probably had resources to go elsewhere out of their neighborhood if they didn't have them. But in this sample, blacks and Hispanics were much more physically active if they had recreation resources nearby. So I think that's another stimulus for us to find ways of getting facilities and or programs available to the populations that need it most. Yes?
Do you know what this data looks like if you control for income?
I can't imagine that they didn't control for income. It's a very sophisticated group. And the reference for this one is on our newest research summary that's on the Active Living Research website. So you can get more details from that. Okay, so that's a very quick view of the research. I know that there's a lot of people, several people in the room interested in seniors and older adults, and I would say that there's on the built environment side, there's less research on there's less research on seniors, but what we have is consistent. If they live in walkable neighborhoods, they're more physically active, and if they have access to, recreation facilities with good aesthetics, they're more active there too. So I've used up all my time. Let me just tell you a couple of things about active living research. And if you want to know more, our website is here, activelivingresearch.org. We have lots of information. We have a lot of journals, journal supplements that we have developed. They're all freely accessible. We have summaries of research written for policymakers and lay people that you can use. And we have three goals: to build a strong research base, to build a transdisciplinary field of researchers, and to use the research to inform, guide, stimulate, push for policy changes that would be consistent with the research. And I think I just want to mention that we've been recently renewed to contribute to the Foundation's goal of reversing the epidemic of childhood obesity by 2015. We have a larger research budget than before at $15.5 million, and we're going to be focusing on the population groups at highest risk for childhood obesity. And we're going to be continuing our work with built environment, but focusing more on policy, on the economic factors driving these issues, and the interaction with kind of social environment and cultural factors such as crime, traffic, and the specific cultures of the populations. So, I think I will just leave it there. So, thank you for your attention.
I should have given that to
Oh, yeah,
Chair.
okay.
So thank you, everyone, and I think you need to catch your plane, right? So
I can, if people want to stay for a few minutes of questions, I can do that. I'm not in that big of a crush.
okay, so maybe a couple questions. But before, just so I have, I wanted to give you this book about Portland,
Oh,
so you
good.
can learn a little bit more about how we got to the way we are.
When people say, well, what are good examples of cities doing good things to promote activity? Portland is first on the list. So I'm promoting you guys all the time.
Okay, so we have time for a couple questions, and then those of you who are enrolled in the class, I haven't really taken attendance, so please come afterwards and check in. So right there, and then Ariana, and then Steve.
Yeah, I don't think everything works. I had a question on when they were doing the study for the kids, like the boundaries. Like my daughter, we live within a mile, so she's forced to walk to school. So I think a lot of that is not they're wanting to, they're being forced. Did they take that, as a covariant that, those kids are forced to walk? Does that make the numbers go up higher?
No, we didn't know about that.
You didn't know about that?
No, so
okay.
we couldn't take that into account.
Right, and the lack of PE classes.
That's a whole separate conversation.
Okay.
Which I would say I've been working on for years. And that is an evidence-based strategy. We know how to provide good, physically active physical education, but this is an area where we choose not to use what we know. So most physical education is terrible if it happens at all. So,
and my other question was, it seems like our focus on obesity, and I'm curious why people like yourselves and other organizations don't maybe try to override that focus, is on pills and diets and surgery, and that's what we see out there to get rid of obesity. I don't hear anything in the media, on the news or whatever, try to do physical activity. It's about, here, take this pill, go on this diet, and have this surgery, and so it seems like we're kind of, have a mindset.
all of those are driven by private enterprise. All of the obesity epidemic is a wonderful money-making opportunity, right? And you can promise any kind of gimmick or quackery and make a fortune if you advertise it. But nobody is paying for physical activity promotion, right? So who's making money off of that? A little bit. So, but what is Nike promoting? Athletes, right? And which have little or no relevance to the rest of us. In my view, this physical activity promotion needs to be seen as a public good, a public health function. It needs to be paid for publicly because the whole public is going to benefit. But that is not happening right now. Needs to happen. Next question.
Can you speak to the future of, or at least your opinion, the future of health impact assessments as a policy tool for promoting healthy environments?
Health impact assessments, yes. I think very valuable tool. We are planning to, through active living research, fund some of those. I think right now the method is still being developed, and we need to kind of get some agreement on the methods, the approaches, how do you go about it, and have a lot of examples of health impact assessments. And I think that will lay the groundwork for then what needs to be the next step of getting getting health impact assessments being required, right, for major transportation projects, major construction projects, and that sort of thing. At what level? We're a long way from that. I think wherever the at the level at which the decisions are made. So I'd like to see health impact assessments for freeways myself, and for each major construction project. Let's compare the health impact of putting suburbs on the edge versus putting that money into infill. All right, and to make that part of the decision making. Economic assessment, environmental assessment, health assessment. Okay, done. Price of gas increased. Okay, we succeeded. So I think that's going to come, but we're at the very early stages, and I think we need to develop the tool so it has some credibility behind it. We need to get some experience doing it. We need to teach more people how to do it. And then we need to push for getting health impact assessments as part of, and hopefully a required part of, the decision-making process. But I don't think that's going to happen in the next 3 years. Over here.
Yes, I guess somewhat related question. I know with health impact assessments, one of the things that they really try and do is take a really comprehensive look at whatever it is being promoted or being developed. And certainly with promoting walking, there are a number of benefits, but I'm wondering if there's much research out there about potential, I guess, negative side effects in terms of increased potential for being hit by a car, for example, or even increased exposure to air toxins.
I think those other outcomes are, kind of siloed. There's the injury people that look at injury. There's the air pollution people that look at that. There's the obesity and physical activity people that look at that. And health impact assessment would be a mechanism for drawing all of those together. But I think, yes, you should look at, potential negative outcomes. And I've heard that, in walkable areas, even though people are walking more, they're denser, and the driving is more concentrated in that area. The people who live there are driving less, but there's kind of pockets of higher pollution. And the injuries has got to be dependent on the specifics of the designs. And I think that's going to be the factor there. But I think all of those things should be integrated.
Yeah, so maybe I'm going to
Okay. All right.
cut it off because the whole seminar is supposed to end. You have about a 3 o'clock flight to catch. So I want to thank everyone for coming, and again remind the students enrolled to please come and check in with me for attendance purposes. Thank you.